Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist, and today I'm going to be showing you a wonderful, successful routine for relieving SI joint pain. These are physical therapy exercises you're going to be doing today. And if you're someone who has not really gotten any kind of relief so far with SI joint pain, or maybe you're someone who's just starting out, this is your video. Let's get started. All right, so for these exercises, there's 4 of them. You'll need a small vinyl ball. This is a 4-inch ball. If you're looking for something similar, I've got a link in the description below to something like this. And then you need either a block, a yoga block, or a pillow that's folded in half. You can use either one. I'll be using the block during today's video. So you're going to be lying on your back for this first exercise. This is for the transverse abdominis muscles. And we're learning to activate them because we usually lose how to use these muscles through our life. So you're going to get down in a good position, lie on your back, roll over your side and roll to your back. In this exercise, it's really about activating and feeling it. So you're not going to see like a lot of movement here. It's so subtle, but that's the idea. We just want to tighten it and relax it so that you can start feeling what this muscle feels like. All right, so it's going to be this idea. We're going to do a contraction, we're going to hold it for 5 seconds, let it go, and we're going to do 10 repetitions. Here's what you want to do. Draw your lower abdominal area back to your spine. You might feel your hip roll a little bit. Draw it back to your spine and really tense it. So it's way down here. You're not tensing here, way down here. And then after 5 seconds, we're going to relax. All right, so let's get started. So here's number 1. Draw that lower abdominal area down to your spine. Hold tight. And let go. You might feel flattening. That's good too. Here we go again. Number 2. Draw it back over and down to your spine. Hold it tight. Feel what that feels like. Let it go. And again, number 3, it's also like the zipping up the zipper on a tight pair of jeans. You're just working really hard to get that zipper up. Hold it and feel that zipper and let it go. Very good. Number 4, bring it back, hold it tight, press the lower abdominal area down to the spine, hold, feel, hold, 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 let it go. And again, number 5, zipping up that zipper, holding it tight, and let it go. Number 6, bringing the lower abdomen down to your spine and let that go. And again, bringing it back, lowering it, it's nice and tight. And let it go. Here's the 8. Just 2 more after this one. Really feel what that feels like. That's the important part here. Let it go. And again, zip up that tight jean zipper. Hold it tight. Feel it. Might be fatiguing. And let it go. And last one. Bring that abdominal area to your spine really hard. Hold it tight. The zipper is closed. Hold it tight and let it go. Very good. Okay, this next one is we're going to be using the lower abdominal muscles, that transverse abdominis. And if I'm going to bring up the base of my, mat here just because I need my feet to slide. So, but for you guys, you can just move yourself down on your mat to let your feet slide on a softer or on a slidey surface. I happen to be using a pillow, by the way, just because I think it's comfortable. You can or cannot, doesn't matter. All right, so you're going to take a nice deep breath. We're going to do that same technique that we did before. And you're going to hold that, and as you hold it, you're going to take one leg, you're going to slide the foot out without letting the pelvis move and not arching your back. So this area has to stay very still while we're doing that. We're going to do 10 on one leg and we're going to do 10 on the other. All right, here we go. Tighten up the transverse abdominis. Hold that pelvic area tight and still while you lower, straighten and lower. Relax. And again, same side. Tighten in here. Don't let yourself move. Don't arch your back while that foot's moving in and out. And relax. Same thing. It's slow movement. We want to control all this movement. Relax. Because, now back again, tighten. Because this muscle is what helps the pelvis have stability and relieve any SIJ problems. That's why we're working here. And again, tighten. Very good. Squeeze again. Number 6. Got 4 more after this one. Let go of that contraction. Right back in again. Hold it. Hold that lower abdominal area back to the spine. Don't let it move. Don't let your pelvis move. Good. Tighten up first before your leg goes out. Come on back in. Let it go. 2 more. Tighten up or zip up, whichever makes more sense to you. Relax. And number 10. Tighten up, out, and back. Very good. Take 2 deep breaths, and we'll go to the other side. Ready? Here you go. Zip up, and there goes that leg on the other side. Relax. Tighten again. Here's number 2. Let it relax. Again, zip up and move that heel out and back. Pelvis is perfectly still. There's no arching in the low back. Let it go. Again, tighten up. And so we're not going fast on any of these. Relax and tighten up again. We're doing controlled movement. We're doing controlled movement because we're trying to remind these transverse abdominis they have to relax. They have to act. Tighten up again. This is number 6. Let it relax. Tighten again, real tight. Keep this all nice and still. If you're starting to move a little bit, just reset. So, and a reset would be going back to the beginning. Hold that muscle tight. Tighten back against the lower abdominal before you let your leg out. If you're still moving your pelvis, then just go back and do 3 more of the ones we did at the beginning where you're just tightening and relaxing. And again, number 9, it's got that zipped up. Let that foot out. Let that go. Number 10, tighten and slide out and back. Very good. Okay, we're going to go on our side now. We're going to work some glute muscles. Glute muscles are very important when it comes to, and I'm going to get my yoga block. Glute muscles are very important to helping the SI joint being stable and not getting overused. And so when those muscles get relaxed and they're weak, you tend to start having SIJ problems. All right, so you're going to bend your knees so they're in front of the hip. My knees aren't down below. They're not up here towards my chest. This is a 90 degree, and then the knees are also 90 degrees. I'm going to move this like this. If you have a pillow you're using, just use your folded pillow. Knees are stacked right on top of each other. Hips are stacked right on top of each other. And in this position, all you're going to do, you're going to use this muscle, and we use it by lifting the heel up and down. This should not move. Your hips should not move. That's how you know you're doing it right. That's the position. I might give myself a little more edge of the block in front of my knee. All right, we're going to do 2 sets of 10. Ready? Here we go. Lift that up and slow lower. Very good. And you want to feel that right through here. Here's number 4. If you're not coming up very far, that's fine. The stronger you get, you'll find that your foot will be coming up higher and higher. The knee is pressing down into this, by the way. That'll keep your leg in the natural position, and it'll keep your pelvis from moving. There's number 8, number 9, and number 10. Good. Take a short break. And ready? Let's start again. Another set of 10. Ankle is coming up. The knee is staying centered right over the other knee. The block doesn't move. Sometimes people tend to do this kind of a thing. And that would be using different muscle groups. We want to get the glute medius. We want to get the glute minimus to help. That was number 5, to help the SIJ joint to not have to do so much work. That's one of the reasons it's inflamed and painful, is because it's overuse, because it's doing the job of these muscles instead of these muscles doing their job. So we're just got to get them strong again. Here's number 10. Take a short break. We are going to do one more set of 10. I know I said 2 sets, but we're doing a third set. All right, here we go. Usually you just need like 2 deep breaths, or 5 to 10 seconds between repetitions, so that you can, or between sets rather, not repetitions, just to help get a good blood flow in there, get some oxygenated blood, so you can continue doing really good contractions instead of doing 30 in a row. We like to break it up for that reason. Here's number 6. Here's number 7. And you want it quality and control. We're not doing jerky, fast motion. We're making the muscle really work. Last one. Very good. Okay, you're going to roll back to your back. And you're going to grab that ball. And we're going to work the fascia now. So we've just done some strengthening to help the SI joint. Now we're going to work the muscle and the fascia of the piriformis. When they're tight, the poor SI joint gets compressed, smashed, irritated, inflamed, and you're off and running with SI joint pain. So you're going to take your ball and you're going to lift up. So whichever side you're having the SI joint pain, that's the side of your hip, your buttock, that you're going to put the ball in. You put it underneath, and you're going in that hollow of the cheek. You're looking for any place that feels tight or tender. So I'm not back over like under my spine, I'm kind of out to the side. And I'll have a good little picture of that for you, so you know where to put this. And we're going to do a myofascial technique. So get your feet a little bit further than hip distance apart. You can put a fist underneath the opposite side, or a roll towel under your other hip, so you're not working hard to keep your weight over on that. We've got the timer started. We're going to be here for 5 minutes. So we're working both the muscle and the fascia. What I found with my patients is, once I started introducing fascia work and I addressed the myofascial restrictions with people, their success rate went up and the permanency to the positive changes came in. So fascia is the connective tissue in our body. And the connective tissue is kind of like a sinewy cobweb, and it infuses the muscle. The trick, though, is the fascia is the boss of the muscle. So as tight or as lengthened that the fascia is, the muscle will be that tight or that lengthened. Well, fascia, or the connective tissue, binds down and tightens and dehydrates over our lifetime from overuse, repetitive use, stress, things like that. And when it does, it tightens and it pulls the muscle tissue that it's infused inside of with it. And so we can do muscle stretches all day long, but if we're not addressing the fascia, that tightened fascia just pulls the muscle right back into tension. So we're addressing all the problems that cause SI joint dysfunction and pain, strengthening the muscles that have become weak and cause the SI joint to have to overwork when you're lifting, carrying, reaching, twisting, and also addressing the fascia that is keeping the muscles that have become tightened down and unable to lengthen again. So that's why I like this routine. It's fully rounded, and we get the whole focus, the whole encompass, every kind of problem, SIJ, pain and dysfunction is being impacted by. But very often in traditional medicine, it doesn't affect or doesn't address the fascial component, and that's what we're doing right now. Kind of a bonus. While you're there, you might feel some burning. That's great. It means you found that's a sign of an old fascial restriction that's been there a long time, probably a couple decades. No problem. If it's too painful and you feel like you're tense or you're holding your breath, feel free to use something a little softer in your hips. Some of you might be so tender in this piriformis muscle, and the fascia in the piriformis muscle might be so tender for you. You might have to start with something like a folded washcloth or a loosely knotted washcloth, and that's okay. Start where your body can allow you to start. Everybody's body's different. All right. In that 3 minutes. Make sure your breathing is soft and connect in with what you're feeling, where that ball is, or your loosely knotted washcloth, whatever you're using. Feel what that feels like in there. Is it tender? Does it feel like a bruise? Is it just tight? Sometimes people say, I just feel like I have a rock in there. That is a super, super tight restriction in the muscle and the fascia if you feel like you have a rock. But if you stay there, well, we have to stay here for 5 minutes. That's how you release fascia. It's the time factor. It doesn't stretch until after 5 minutes. Weird, right? But that's the science tells us that. It won't release until after 5 minutes. So having said that, that means you can stay here for 8, 9, 10 minutes if you want. But for today's purposes and for this video, I'm just going to stay here 5 minutes. Feel free to stay here as long as you like. You'll just get more releases, more softening. And as that softens, the SI joint, as the piriformis relaxes, now it takes the pressure off the SI joint. It's not compressing it anymore. And as the SI joint gets decompressed and gets to move back into its natural position, all of a sudden inflammation now is relieved. And when you relieve inflammation, you relieve pain. So you would continue doing these set of exercises for the next 14 days, really get a good change in that SIJ pain. And then after that, maybe twice a week or so to help maintain those positive changes, especially if you've had something like this for a long time. Got to stay with it. All right, we're coming up to the end of our 5 minutes. Very good. Like I said, you're welcome to stay here longer. You'll just get more release and more relaxation. Do the other side too for a couple of times just to help make sure that there's nothing impacting your SI joint pain from the other piriformis. All right, thank you so much for being with me today. I invite you to subscribe to my channel so every time a new video comes up, you are notified and you can continue living that pain-free lifestyle that you deserve. Thanks again. I'll see you in the next video.